The One Big Beautiful Bill Act has been law for more than a month now, and the details are coming into focus. This week, we're starting a series of conversations with the Minnesota Hospital Association's Becky Wifstrand about what comes next. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm your host, Tim Nelson, and I'm joined in this episode by Becky Wifstrand, Director of Federal Policy and Regulatory Affairs for the MHA. I asked her what we've learned in the weeks since the One Big Beautiful Bill Act was signed into law.
So Congress passed this huge bill with wide sweeping implications, and then they basically went back to their districts. So they're all back home during the August recess, and we're definitely seeing some of them are facing some feedback from constituents and concerns about the cuts, especially around the Medicaid program. And, there's a lot in this bill that will be implemented in the coming years, but I think what MHA is most focused at on the moment is the Rural Health Transformation Program, which was added to the bill in the last moments before it was passed by the Senate.
So tell me a little bit more about that. Obviously, there's quite a bit of money there.
Yes. So this program was added with concerns from some senators in terms of how the bill was going to affect hospitals, especially in rural areas, obviously. So it was first proposed at $25 billion, and that was up to $50 billion. So the final program in the law is $50 billion over 5 years. And this will be distributed with $10 billion every year, 2026 through 2030. So given that first pot of money is getting distributed in 2026, there's a lot of questions in terms of what that means, what that looks like. And that's really that kind of first step we're looking at.
There's a couple different ways they're giving this out. They're taking some applications, and then the CMS director has some discretion about how the money goes out. How does this get to Minnesota? How do we funnel some of this money here?
Yeah, so you're exactly right. In the law, there's 2 tiers of funding. So that first tier of funding is half will be, how the law is structured, it says half will be distributed equally among states who apply to CMS and are approved by CMS. And so if you're looking at that, so you have a $50 billion is $25 billion with $5 billion a year. If you're distributing equally among all states, we're looking at maybe $100 million to Minnesota. But that is obviously built with some assumptions. That's assuming all states will apply, all states will get awarded the money. But that's what we're looking at in terms of that first year. And so to get those tier 1 funds, the states will need to submit a one-time rural health transformation plan. But what's really interesting to a lot of people is that in the law, that rural health transformation plan must be submitted and approved by December 31st, 2025. So given that's just a few months away, there's a lot that needs to get done for that. And then I'll just mention the tier 2 funds that are also included in the law. This will be half of that money will be distributed at the discretion of the CMS administrator, like you mentioned. This will be based on certain rural characteristics of the states. So there's a lot of questions in terms of, will Minnesota qualify for those fundings?
And who's doing this application? Who's going to submit the paperwork at the end of 2025?
Yeah, so the state is still working through that and figuring that out, but we believe that it will be a combination of the Department of Health, the Department of Human Services, and Minnesota Management and Budget. So a lot of the state agencies working together on this, and obviously MHA will be an important stakeholder in guiding this rural health transformation plan.
So I've been reading a lot about the definitions of rural hospitals, that it wasn't quite as clean cut as maybe even Congress thought when they passed this, that a lot of people are considering themselves eligible. Tell me a little bit about how this definition works and what kind of facilities are going to be eligible for this money.
Yeah, so the way the law was written, there is a definition of a rural health facility, but to clarify how that is built into the law, that is really all that is it's addressing the characteristics that the CMS administrator will be looking at for those tier 2 funds. So it has nothing to do with the eligibility of the overall funding pot. So for that rural health transformation program application that the states are doing, there's a lot of questions in terms of how hospitals will be eligible as part of that. But what we do know is that it was the intent of Congress for this money to go to rural hospitals. So I think a lot is riding on CMS guidance, which we are waiting for that to be released. We have expect it to be released in early September, but really hoping a lot of these questions will be answered, especially in terms of those eligible facilities.
And when the money comes, does it come as Medicaid reimbursements? Does it come as some other program relief? What's this going to look like if and when it eventually arrives?
Yeah, so that's a good question. What the law states is a lot of different allowable uses of the funds. So part of that is it could be direct payments to providers, but a lot of it, the list of allowable uses really centers around technology, cybersecurity, workforce development. There's a lot of opportunity within this plan to kind of build some more innovative funding streams. And so I think that's where it really is important in terms of MHA giving feedback to the state in terms of how this is structured, because there's still a lot of questions on what CMS will require in terms of how it will funnel down to the eligible facilities.
And you talked about the alphabet soup of state agencies that are working on this. What about the Minnesota Hospital Association? What's MHA doing to get this application done and really elaborate how this new program is going to work?
Yeah, well, right now, as part of like this podcast is doing, we're really educating our members and letting them know that this is coming down the pike. And then we will be a key stakeholder for these state agencies to give feedback. But as I keep on saying, I hate to be a broken record, there's just a lot of questions that need to be answered by this CMS guidance. And I think that will really dictate moving forward how MHA and the state will move forward on this plan.
So there's a lot of moving parts to this law coming down the road here, a lot of topics that we're going to touch on in future episodes of Hospital Matters. Give us a little idea of what listeners can expect coming up.
Yeah, so, while this One Big Beautiful Bill Act was getting debated, we obviously talked a lot about the provisions within it, but we really want to take a step back and go through some of these specific provisions, because I think a lot of people realize there's Medicaid work requirements, but what does that mean for Minnesota? And there's some different administrative requirements around the Medicaid program. Again, what does that mean for Minnesota? So what we're going to do in following episodes is really go through some of those provisions of the law and really talk about when they'll be implemented, what that timeline looks like, because there's a lot of confusion too about the provisions have different implementation timelines. And so we really want to make sure our members understand when these particular provisions will affect them, what they can do to prepare. And we'll be talking again about those Medicaid work requirements, the eligibility changes, and lots of things like that.
Well, I look forward to hearing more. Thank you so much.
Thanks, Tim.
Again, that's Becky Wifstrand, Director of Federal Policy and Regulatory Affairs for the Minnesota Hospital Association. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.